To open the conference, we thought we'd begin with a few easy questions. Who are we? Why are we here? And what are we capable of? With the help of psychedelics, the healing journey offers us the chance to discover our own answers to these questions. Today's first speaker draws on personal experience with clients and his own experience to explore the question of human potential. Dr. Will Sue is a psychiatrist and spokesperson for psychedelic medicine. Graduating from UCLA and Oxford, he completed his training at Harvard, where he served on the faculty for 6 years. He now runs a private clinic in New York and devotes the rest of his time to educating clinicians and the general public about the potential of psychedelics as tools for healing. Here today to talk to us about wisdom, honesty, and the voice, please welcome Dr. Will Sue.
Wow, welcome everyone, and what a great way to start the conference, Dominic, and thank you for that introduction, and also thank you, Sarah and the Eden team, for inviting me back here just a couple of years later from the first conference. And it's really hard to see anyone because the lights are so bright, so yeah, but I can see Sarah, so maybe I'll just pretend I'm talking to you about this. So, so I wanted to start off what I wanted to share with you today with this quote by Robert Woodworth, where he says, "First, psychology lost its soul, then it lost its mind, and then it lost its consciousness." And I'm going to say it wasn't just psychology. I think this is my own field of psychiatry, and I also feel that it's the state of humanity that we seem to be living in right now. And so I think it's really important to start with what psychedelic actually means. And I think the most common definition that we'll see out there that you've probably heard is that of mind manifesting, right? But it's really, mind has been used in terms of the interpretation of psyche only since about the 1950s. But if we go back to the Greeks, psyche means something much deeper than just the mind, right? And so it means breath or life or soul. Right? And there's so much more to that than just the mind, right? And like, we have plenty of ideas. I don't think we're suffering from ideas in the world right now, but I would say that we're suffering from things like the soul. And then delos, which is the second part of the word, which means something like to reveal, to make visible. Okay, so I think of these medicines as revealers of the soul. And I think it's really important to have that foundation as we continue to explore these medicines. And moreover, I'm going to argue that the soul is why you're here. It's why we've each shown up today. I think that's why there's so much interest in these medicines, right? It's because of the soul. I think we're living at a time where there's a lot of emptiness, and there's a void that we're trying to fill in humanity, right? That's why there's such a need for psychedelics. But by saying that there's such a need, I'm not trying to say that the psychedelics are actually going to fill this, but it's more of a representation of why there's so much excitement around psychedelics. I think humans are hungry for more. I think we all know that. And I think people are also literally dying because of the collective disconnection from the soul that we're living in right now. And so with that, we'll start with psychedelics, I would say revealers of the soul. And, so just to sort of even start out with a basic example of the soul, with this beautiful picture of Martha Graham, which some of you may know, artist, dancer in New York City, who had passed some time ago. But I love this image of her and also this definition, which I think goes together, which is the soul is the invisible animating principle or entity which occupies and directs the physical body, right? I think of it as the life force that wants you to move and to speak and to create a certain way. Right? To take hold of the single opportunity that you have to show the world who you are. And if we resist that force, it hurts. Okay? It hurts in the body, and the more deeply we resist it, the more it hurts. And I'm going to say, as it should. Because this pain is trying to redirect our choices. And I'm going to say that this pain from that discrepancy is at the root of pain and suffering for humanity. But in my own profession of psychiatry, we call this pain, incorrectly, diseases or symptoms of disorders rooted in brain dysfunction or neurochemical imbalances. This is a grave error. And despite soul being at the root of the word psychiatry and psychology, which should mean soul healing, soul, calling, and purpose were never mentioned once in my training as a psychiatrist or in my faculty positions afterwards. And as psychiatrists and psychologists, right, we're supposed to be healers of the soul. Right? That's the task that has been imparted upon us, and we've been failing at that. And so today I'd like to share a bit about what I've come to learn about the process of healing the soul and how I came about this perspective myself, which stems from my own journey and my work with my patients. And in doing so, I hope to provide at least some interesting, if not helpful, insights as you continue on your journey. Does that sound okay? Okay. And I'm going to split what I'm going to say into 3 parts today: wisdom, honesty, and the voice. And I like to think of wisdom as the reconnecting to the soul, the process of initially sort of finding our way back to this inner intelligence that we have. And for me, at least, the big moment occurred in 2012. I had just finished my first year of psychiatry training at the Massachusetts General Hospital. And for those who don't know, the intern year of a doctor is really the most challenging year. It's like you're working 80 to 90 hours a week. A week a month, you're probably sleeping in the hospital for very little pay. Not to mention just the trauma of the environment of the medical system itself. But like many other times, I was excited. I had just gotten something very difficult done and passed me. And I said, now I'm going to get the joy. Now I'm going to get the happiness. And I'd started my second year, which is all psychiatry. And I'm like, now I'm surrounded by my people. It's going to be okay now. And I remember a couple months into that, I was in my inpatient psychiatry rotation. And we had a lecture on the STAR-D trial, which is the largest trial done to date within psychiatry, which looks at the impact of SSRIs on major depressive disorder. And I remember that day very distinctly because the professor had said to us, sort of prepping for the talk, that he was going to show us the best data that we have in psychiatry for treating a mental illness. And so I was really excited to hear about this. But at the end of his talk, as he summarized the data, he ended up sharing with us that approximately 30% of people, and this is a study that was tens of thousands of people, so 30% at the end no longer had depression. And my heart sank at that point because I think after all the exhaustion of the year, but also I had been in school for 14 straight years after high school. And I thought to myself, for what? For 1/3 of people getting better. This was our best. But then the punchline came when he actually then compared it to the placebo results, which were about 19%. And that really, really was a turning point in my life because, I smile a little bit now, I heard some giggles, but at that time, if you can imagine the position I was in, I was 34 years old, had put all this time and energy and money for 10% better than placebo. So it was the beginning it was sort of a wake-up call and a beginning of seeing through a delusion. And so after that, I had already been suffering from anxiety, depression, and undiagnosed PTSD at that time. But then I started asking my classmates as well, what's your experience with this? Do you see what I see? But I was mostly met with blank stares or just, confusion or silence. Like I felt like I was going through just a time of being crazy. I was like, why isn't it that anyone else is seeing what I'm seeing? Is there something wrong with me? And then there was the day-to-day, my actual experience with my clients, seeing them for 15 minutes, asking them about symptoms, just checklists, and not getting to ask them the questions of what I really wanted to ask them, like, how's life at home? Do you like what you do for work? What is it that you would like to be doing? There was no time for that. This wasn't really why I started, and this isn't what I dreamt of when I was thinking about being a psychiatrist in college in my early 20s. And I think moreover, in addition to that, was that by then, both therapy and medications had failed me significantly, time after time. And so, in addition to becoming more anxious and depressed, I also became suicidal at that point in my life. So this next quote I'd like to share is by a psychiatrist named Fritz Perls. So, lose your mind and come to your senses. So, as I was indicating earlier, if we suppress the soul, the body's going to hurt. And by the beginning of my training, my body had been screaming at me for a long, long time. And either I couldn't hear it or I had quieted it. Certainly by then, alcohol was one of those things I was using, spending my day doing something I really didn't want to do, in a place I didn't want to do it, and doing something I didn't believe in. But then, like many, at the end of the day, I drank, fell asleep, and then repeated that the next day, right? Day after day, year after year. Or I'd sometimes use medications like benzodiazepines to quiet the soul, right? Or in other times, just simply choosing to live in denial. But all the time, my soul kept telling me something was wrong. And I thought I was losing my mind. And in many ways, I was. And I remember there was this moment where I was thinking to myself, my experience tells me what is happening doesn't make any sense and it's not working. But this institution, I remember walking around the different buildings at Harvard, which some of them are these large, marble, impressive buildings. But I'm like, either I'm right, but this thing I'm looking at is wrong, or they're right and I'm crazy. And it was really something that I wrestled with painfully for quite some time. And that was 2013, and I had not yet touched a psychedelic. I was about a year before I would try a psychedelic. But something that was really helpful, at least in that meantime, for me to keep going, was I can't remember how I found this video, but it was a YouTube video about a doctor who I'd never heard of, and not Fritz Perls, but of Gabor Mate. And at least at that point, it was enough for me to connect, and at least through the internet, to connect with a doctor who had been speaking my language, who had been seeing the world the way I saw it. It was enough for me to keep going while I was in this dark, deep, dark place myself. And soon after that, I tried my first psychedelic, DMT, and then someone introduced me to Rick Doblin, who lived a couple blocks from the hospital that I had been working at that time. And thankfully, what I'm trying to illustrate here is the importance of community as we expose more of our souls, as we connect deeper to who we really are. Community is very important. And so then I continued to actually then allow the denial to fall. I felt I had the support to allow the denials to start falling, and then the wisdom of my soul to start coming to the surface more. But it was not easy. Right? There was a lot to lose for the part of me that had constructed and been contributing to the delusion I had been living in. So I'd like to move on now to the next part, honesty, which I think of as lying to or denying the soul. And I'd like to go back to that moment that I was describing, this moment of either I'm crazy and the system is right, or the system is right, or the system is wrong, right? And I'm right, which was just this moment of confusion. I'm going to say for me, that wasn't the first time I ever had that experience. And I think for most of us, that experience first happens in the childhood home. Right? And there's one memory as I was thinking about this talk that kept coming to mind, which was in kindergarten, where I had this report card where the year was summarized in 3 different sections, but each one repeated the same thing on mine, which was that Will talks out of turn, Will keeps getting out of his seat, and Will is misbehaving. And that stands out very powerfully to me because it was a result of those report cards that my father began punishing me and physically abusing me for the first time. And that continued into my early teens. And soon after that came his alcoholism and drunkenness, and then also near daily arguing in my household, which was very chaotic. So what I'm trying to paint a picture is a lot of pain started entering my life in my childhood. But my body this entire time knew that this was wrong, knew what I was living in was wrong. My body knew that it was wrong for a child to be physically abused. My soul knew that it was wrong for a child to watch his father stumble and not be able to walk because of intoxication. Right? My soul knew that parents should not be screaming at each other every day. But in order to survive that environment, my mind had to start agreeing with the delusion that this was the way life is, that this was okay and normal. And my body had to stop feeling the pain of what it was to live in that environment. So in other words, I learned to dissociate from my emotions. More tragically, I think that also represents that I began to dissociate from my soul. Right? Like the report card said, I actually then started to sit still, to be quiet, and to behave. And from that place, I started creating an entire separate reality from this place of dissociation. And to summarize, then you can see why it was that as a 34-year-old, I end up at a place like Harvard, unhappy and continuing to do things that I didn't want to do. Right? Those foundations were laid much before that. But once we have wisdom come up, right? Once we have insight come up, with or without psychedelics, then we're faced with making choices, right? Because this is what happens when we start to look at ourselves honestly. And this next quote is by another psychiatrist. I'm realizing for not being such a fan of psychiatry, I'm showing a lot of quotes by psychiatrists. So this one's by a favorite of mine, though, James Hillman, who says, "The capacity for people to kid themselves is huge. Living on illusions or delusions, and then the reestablishing of these illusions or delusions requires a big effort to keep them from being seen through." So in other words, I like to think of honesty being disruptive. Right? And for the 99+% of us who grew up in families, religions, cultures that influenced us away from our souls, when we look at things honestly, inevitably we see ways that we are not living in alignment with ourselves. And then that honesty can mean loss. Right? It can mean loss of attachment to our work, loss of attachment to our social status, our friendships, our families, our romantic partnerships. It's painful. Right? And we're likely living at the time of the most collective dishonesty in history. And it's a very painful time. Okay, and lastly, I'd like to talk about the voice, which I think about as expressing or silencing of the soul. And as I've thought about the talk that I wanted to give here today, the image of a loom, a weaving loom, kept coming to mind for me. You know, and as we get more connected to our wisdom and our honesty, then I think it's important then that we carry ourselves into the world and into community. In other words, we have the opportunity to take action upon our honesty. You know, and I've come to realize that the most powerful and precious tool of creation that we have is our voices. Right? It's how we make ourselves known to the world. It's how we announce ourselves to others. This is what I believe, and this is who I am. And as I've thought about the voice in the past months, and this image of the loom, I started to think that the voice is like the yarn that we use to weave our life story. And that the words we choose are like the quality of that yarn. And so as we align our wisdom and honesty further with the soul, it's crucial that we bring more attention to how we use our voices and our words. And this is a quote that was shared with me by a vocal teacher from one of her teachers who I don't remember. So this one goes, The tongue holds the history of everything that we wanted to say and didn't say. And it also holds the history of everything that we wanted to say that we regret saying. Now, I love this quote for many reasons. I also hate this quote for many reasons. But no, joking aside, it's one part I really like about it is that it reminds me of the mind-body connection, right? By mentioning the tongue and the tissue, it honors that what we weave in life remains a part of who we are and in our bodies. And it also, in a painful way, reminds us that we can use our words or our silence against ourselves. So sometimes inaction, silence, and our words can be a betrayal of our soul. And sometimes then, we end up creating circumstances and lives with those words that don't align with who we really want to be. And the body will let you know it, as it always does. And I think about this it's so simple, yet so, I think, complicated at this time. And I was thinking about my current clients, but even the clients that, if I think back to every client I've ever had, and thinking about the voice, right, is even simple yes and no. Like feeling is something a yes or a no, and then actually communicating that. I think everyone that I'm working with right now is working on some version of that for themselves. I think it just illustrates just what a time that we're living in right now. And I think even if you add to that something a little bit more complex, like I want or I don't want, I think it's just, again, many people I know are still working on that themselves. Okay, so wisdom, honesty, and the voice. I wanted to sort of put this back up here to show that this isn't really a linear or one-time process, right? That this is really what I would call the healing journey. I think other people would call this the hero's journey. One of the things about this is that we'll go through this, and we continue to go through this process throughout our lives. I don't think this work on ourselves ever ends. And if another thing that you'll notice is I actually didn't really mention psychedelics at all, really, so far, or very little so far, because I think that this healing journey is separate than the psychedelics. I think psychedelics can come in and play a role and be helpful tools as we go along these journeys, but ultimately, we can continue to go on these ourselves. And when I thought about how psychedelics do fit into this healing journey, I was realizing they're really good at providing insight, right? Revealers of the soul, or they provide wisdom. It's not 100% for anyone who has experienced them here, right? But they're really good mirrors, helpful mirrors. But when I was thinking about the second two pieces, honesty and the voice, which require choice, or which offer choice, I'm going to say. And choice being really a result of free will, of demonstrating free will, is that I realized, and I'd be curious what people think, but I've come to realize that psychedelics don't touch free will. And I think that's something really important that I've come to realize, right? That wisdom they can provide, but this day-to-day, making different choices in community, in relationship to other people, that's where the magic lies. And I think that's where the magic of our individual agency and free will lies, right? So choice remains between you and your soul. And I wanted to lastly share this, because I think this shows the community and the interweaving of our different healing journeys, right? And it's really important that we do this, to interweave with each other. And together right now, we're weaving the tapestry of humanity in 2025, and it's really messy out there. And the more we can weave honestly as individuals, the more we can weave honestly and heal as a collective. And so there's just three last points I want to say, as we move forward through this conference. First is keep soul in mind as you navigate this conference and your journey. Number two, I would say, allow yourself to speak from your soul, because I feel that this will free others to do it. And lastly, and most importantly, let yourself be encouraged by your soul. The world needs you and what you're here to contribute. And one last quote. So many of you may be familiar with this one, but there is a vitality, a life force, an energy, a quickening that is translated through you into action. And because there is only one of you in all of time, this expression is unique. And if you block it, it will never exist through any other medium, and it will be lost. The world will not have it. It is not your business to determine how good it is, nor how it compares to other expressions. It is your business to keep it yours clearly and directly, to keep the channel open. Thank you.